Whenever I talk about COVID and the impact this has had on our population and all the people who have died, I will often get comments like this, which is saying that basically doctors and hospitals actually wrote COVID on death certificates when people died of other things, so there weren't nearly as many deaths as we are counting. This is a very common conspiracy theory, and it's kind of attractive, but the problem is that most people haven't actually ever seen a death certificate and seen what goes into filling one out. So let's go through that. So this is what a typical death certificate looks like in Canada. You've got up here your immediate cause of death. So let's say your patient had COVID-19, they got pneumonia, they died of respiratory failure. The immediate cause of death is respiratory failure, but it's due to or as a consequence of, in this case, pneumonia. Now that, in turn, is due to or as a consequence of the third thing, which will be COVID-19, and that's an antecedent cause or the cause that gave rise to that pneumonia. And any death certificate that has COVID-19 listed as the primary cause or as one of the antecedent causes, like in this case, will be counted as a death related to COVID-19 disease. And obviously, in this case, it makes sense because COVID-19 is what led to that pneumonia, which led to the respiratory failure. So even though COVID-19 is not on the very first line, it was clearly responsible for this person's death. So that's an obvious example, but it can also be trickier. People with COVID disease, particularly if they have chronic diseases and particularly if they're very sick with COVID, will often get things like blood clots and strokes and heart attacks. And so the question then is, did the COVID lead to that person dying sooner? Somebody with heart disease might have eventually died with a heart attack, but it's because they had COVID now that they got their heart attack now and died now. So COVID would be one of those antecedent causes, and that would be counted as a death related to COVID-19 disease. But what often happens in hospital is somebody gets admitted with COVID and then a whole cascade of complications happens. And by the time they die, many weeks or months later, COVID-19 is not actually on that death certificate. It's not actually considered a cause of death, even though they would not have died had they not initially come in with COVID-19 disease. And so in many cases with hospital death certificates, we're actually undercounting COVID-19 deaths. On top of that, if you look at excess mortality or the number of people who died during the pandemic versus the number of people who would typically die in a similar amount of time before the pandemic, you see that, in fact, hospital death records vastly undercount the number of people who have died, the excess mortality we've seen during the pandemic. And that is not only because we're probably undercounting hospital deaths, but we're also not counting deaths largely in the community in terms of people who die of COVID disease and, for example, never had a test or had a false negative test. So overall, we are in fact vastly undercounting the number of deaths due to COVID-19, and many studies have shown that.